Morning, my name's Graham Moore. I'm a Professor of Social Sciences and Public Health at Cardiff University, and until very recently I was involved in the School Health Research Network surveys. I've now kind of stepped away from that role and handed over to Dr. Kelly Morgan. So I'll just turn my camera off now so my face isn't in the way. But in terms of policy goals for smoking and tobacco use, across the UK, all nations are aiming to be smoke-free by 2030. There's a real kind of policy ambition to achieve that. The definitions of what we mean by smoke-free is challenging. So long as a consumer product remains available on the market, some people will use it. So smoke-free doesn't necessarily mean zero smoking, but often when people talk about becoming smoke-free, we mean kind of achieving rates of lower than kind of 5% use across the population. And obviously that's going to require action at multiple levels. We need effective action to help smokers who've already taken up smoking to stop, but we also need action to prevent young people from becoming smokers in the first place. The vast majority of adult smokers started smoking in adolescence. I think often within public health, we slightly over-egg the idea that habits and behaviours that people develop in childhood and adolescence track forward into adulthood, so we need to establish healthy behaviours in adolescence. But smoking is such an addictive behaviour that if that behaviour becomes established in adolescence, it's very hard to then extinguish that behaviour in adulthood. So lots of people take up smoking in adolescence and then struggle throughout the rest of their lives to give it up. So preventing smoking uptake in adolescence is a really kind of critical period for prevention efforts. And in longer term action is underway to kind of implement policies and legislation to progressively raise the sales age for tobacco use so that it can never be bought legally by anyone kind of born after a certain date. So just to give some context before we go into some of the more recent data from SHRN, as we probably all know, smoking rates amongst young people have declined rapidly since the turn of the century, and this graph on this slide is based on data that was drawn together for a recent NIHR-funded evaluation study looking at change over time in smoking and vaping, and we can use data from the health behaviour in school-aged children surveys and the more recent School Health Research Network surveys in Wales, combined with data from Scottish surveys and English surveys to look at kind of trends over time. This is just the data from Wales. And we can see here that trying smoking just used to be something that most young people did. Here we're only looking at 13-year-olds and 15-year-olds or year 9s and year 11s, and the reason we've done that was for kind of harmonisation with surveys in other countries where those were the only age groups from whom data were collected. But just looking at 13 to 15-year-olds, most said that they had tried smoking back in 1998. Roughly 1 in 5 were regular smokers in 1998, around about the time that I was leaving school. Ever smoking and regular smoking fell really rapidly from 1998 to about 2013, but then from that point on we did start to see that decline in smoking rates stalling quite significantly. In terms of understanding some of the reasons for some of these declines, we have seen progressively comprehensive tobacco control action. So 1998, the start of this time series, was when the government published its Smoking Kills white paper. That was followed over the following years by the introduction of the Tobacco Advertising and Promotion Bill. 2006, 2007, across the UK nations, we saw smoke-free workplaces legislation introduced. And all of these actions have likely contributed to a widespread kind of denormalisation of smoking. Notably, though, I think when we talk about the way in which kind of policy action has achieved these ends, we do sometimes kind of ignore the fact that a lot of these kind of declines are kind of paralleled in other risk behaviours such as alcohol, cannabis use. So they're not specific to tobacco. So it's possible that other kind of social trends beyond the policy and legislation frameworks are kind of contributing here. So we could see on previous slides, and just to zoom in on that a little bit here, that actually ever and regular smoking amongst 13 and 15-year-olds, and it's similar across all of the age groups, but we're just looking at 13 and 15-year-olds here in Wales. Regular smoking was pretty much flat as a pancake from 2013 for a 6-year period through to 2019. It remained around about 5% throughout this time period. Ever use kind of carried on falling for another couple of years to 2015, but then it also flatlined, remaining very stationary from 2015 down to 2019. And there are lots of kind of reasons that people have put forward for this stalling in declines. So is it down to the rise of e-cigarettes? And we did a lot of analysis kind of looking at how trends in e-cigarettes and tobacco use kind of mirror each other. And actually, during the period of time when e-cigarette use was growing most rapidly, smoking was continuing to fall. Declines in the flattening in smoking rates seemed to happen as kind of growth in e-cigarette use was actually starting to fizzle out anyway. We also kind of looked at things like overlaps with other substance use. We've found that, for example, there was also a co-occurring flattening or kind of slight growth in cannabis use amongst young people in Wales, and cannabis use in most cases co-occurs with tobacco use. A large portion of young people using tobacco are also using cannabis, and vice versa. Or it could just be that kind of broader sort of social and economic trends have impacted across on a range of substance use outcomes across smoking, tobacco, cannabis, smoking, alcohol, cannabis use, and other related outcomes. Okay, so the data that we looked at within the NIHR-funded Tobacco Products Directive evaluation ended in 2019. So what's happened in more recent years? From 2013 to 2019, we can see actually there's been very little reduction in regular smoking, small declines in ever smoking for a couple of years, which then flattened out also. And I'm going to, from this point on, draw on data from the 2019 national report for the School Health Research Network surveys. And for the more recent data sets for 2021-2023, I'll draw on figures from the Public Health Wales Observatory dashboard. And what we can see here is that for the whole of Wales, for all young people aged 11 to 16 in Wales, in 2019, smoking rates were around, regular smoking was about 4%. That dropped to 3% in 2021. And has dropped further to around 2.5% in 2023. So small declines, but a movement in the right direction after a prolonged period of no real movement. And just breaking this down for now by year group, we can see here that for pupils in year 11, so young people aged 15 to 16, there's a clear kind of graded relationship between time and regular smoking. So in 2019, 9%, so roughly 1 in 11 young people were leaving school as a smoker. That fell to around about 7%, about 1 in 14 young people in 2021. And that's fallen further still to almost 5%. To just over 5%, sorry, in 2023. So from 2019 to 2023, we see the number of young people in that final year of school, year 11, who are leaving as smokers has fallen by almost a half. So that's really good progress. We see a similar thing in year 10. So roughly 7% of young people in 2019 were smokers, regular smokers in year 10, so roughly 1 in 14 young people. That dropped to 5% and then dropped a little bit further to almost to just over 4% in 2023. So again, a decline from around 1 in 14 young people being smokers in year 10 down to roughly 1 in 25. Year 9, we see a decline from 2019 through to 2021, but then it kind of remains pretty much stationary from 2019 to 2021. From 2021 to 2023. Year 8 and Year 7, the figures look a little bit flatter. There's some evidence of a gradient in Year 7, perhaps, but not much in Year 8. But I think this is kind of what I'd expect, in that the rates of smoking are so low now in those younger age groups. There's really not that much potential for further movement downwards. So I think it's probably unsurprising that we're now starting to see most of the progress in kind of reducing smoking rates kind of concentrated in the older age groups. Okay, so we also know that smoking is a big driver of health inequalities. It's a really socially patterned behaviour. So for children from poorer families, they will often be much more likely to grow up in households where other people smoke. They'll be more likely to grow up in communities where smoking is more common and remains kind of more normalized. And they'll often be more likely to take up smoking themselves, perhaps as a consequence of the kind of networks that they're sort of nested within. We can see here in 2019 that for a young person from a low affluence household, judged using the family affluence scale, about 6% reported being regular smokers, 4% for those from a medium affluence household, and 3% for those from a more affluent household. Encouragingly, we do see declines in smoking over time in all socioeconomic groups. So for the least affluent groups, there's a decline from 6% in 2019 through to about 4.5% in 2021 and down to about 4% in 2023. There are also declines in the medium affluence and the kind of high affluence groups. And it remains the case that smoking rates are highest amongst children from less affluent families, but we are seeing declines across all parts of the socioeconomic distribution here. So I know many of you listening to this will be working within local authorities and be interested in kind of knowing what's going on within your individual local authority. And I've taken this graph directly from the Public Health Wales Observatory. And what you'll see here is that within individual local authorities, there are few really where changes are more than a fluctuation within a confidence interval. And generally, local authorities with higher smoking rates in 2021 continue to have higher smoking rates in 2023. There are a small number of local authorities where there do seem to be kind of clear declines in smoking rates, but in most cases, there are slight kind of changes in one direction or another, which are kind of just fluctuations within a confidence interval, aren't necessarily meaningful differences from one time point to the next. So I'll briefly talk about vaping now. It's hard to talk about smoking without also talking about vaping. They're very different behaviours with very different risk profiles. Smoking is by far the most risky behaviour. So it's good news that we're seeing smoking falling. But there has been lots of concern about the growth of e-cigarette use in recent years. And e-cigarettes started to emerge, as I'm sure you're all aware, from around sort of 2003. They came onto kind of UK markets more from around 2007, 2008. And by the time youth surveys started to measure the number of people who were using e-cigarettes, they'd become pretty much as kind of commonly used as tobacco cigarettes. So back in 2013, about 12% of young people were saying that they'd ever tried a tobacco cigarette, and about 12% were also saying that they'd tried an e-cigarette. So we did have an NIHR-funded study looking at change over time in experimentation with e-cigarettes and how that changed after the introduction of EU regulations, which placed restrictions on cross-border advertising, mandated that warning labels had to be included around kind of nicotine content, and also kind of restricted the strength of products that could be sold non-medicinally. And we did find that actually after the growth, after the introduction of that legislation, whether it's a causal effect or whether it's a coincidence because interest in e-cigarettes had started to kind of peter out, that actually the growth in e-cigarette experimentation that we'd seen up to that point did start to diminish, and we started to see young people's interest in use of e-cigarettes diminishing a little bit from around 2016 through to 2019. However, as I'm sure you're all aware, that wasn't the end of the story, and shortly after that evaluation finished, newer kind of product and market innovations, most notably kind of disposable e-cigarettes, led to a kind of re-emergence of growth in young people's use of e-cigarettes. So this is data taken from the Smoking Toolkit study, which is conducted across Great Britain, England, Scotland and Wales. And the graph here shows the percentage of current vapers who are using disposable e-cigarettes by age. And this shows that although this is only looking at adults, this is from age 18 upwards, there's a very clear age trend. Disposable e-cigarettes clearly appeal more to younger people. And even though this only goes down as young as 18, I think it's probably quite plausible that continues down into adolescence, that disposable e-cigarettes were becoming particularly popular and particularly prevalent for kind of younger users of e-cigarettes who are experimenting with them or beginning to use them more regularly. So in terms of the most recent data we have on vaping, so in 2019, at the end of the point where we finished the evaluation study that I talked about, e-cigarette use was beginning to level off or even to go into decline, and that was the same across all three of the UK nations that we were looking at. But in the School Health Research Network survey in 2021, around about 20% of young people reported having ever used an e-cigarette. And that was quite similar to 2019, so we didn't see much growth in experimentation, but we were starting to see a rise then in regular weekly or more use of e-cigarettes, which grew from around 3% in 2019 to 5% in 2021. So there's some evidence that although this was a period where tobacco use began to fall again after a period of prolonged plateauing, vaping had started to rise again during that time. And the 2023 data aren't ready yet because of changes in question wording. We had various consultations with school staff and other people who said that actually lots of young people were no longer really understanding the questions on e-cigarettes because that's just a term that's not familiar to them. They use other terms like vapes or other labels to identify these products, and there was concern that perhaps we weren't kind of capturing fully kind of use of e-cigarettes because we were using kind of outdated terminology. So we have done some experimental work kind of varying the questions that we ask to see whether that makes a difference to prevalence estimates. And the kind of methodological work to kind of look at comparability over time isn't yet complete, so those data will come onto the dashboard a bit later, probably early next year. Okay, so just to conclude, I mean, smoking declined rapidly in Wales from the turn of the century to around 2013. We did then start to see those declines stalling for a good few years. We saw a bit of a plateauing in tobacco use up to about 2019, but this downward trend does seem to have resumed in the last two rounds. It's encouraging that we've seen a drop for two surveys in a row. It's not just a random blip, it does seem to be continuing again. There was some evidence of increased vaping as smoking began to fall again in our 2021 data. We don't yet have the latest figures on this. And obviously vaping is far less risky than tobacco, but we do need to keep an eye on rates of vaping as kind of smoking rates continue to decline.